If your dog greeted you this morning and the smell coming off that happy, panting mouth made you turn your head, I want you to pay attention for the next 25 minutes, because that smell is not just a mouth problem. In roughly 2 out of 3 of the dogs I see for chronic bad breath, the mouth is only the chimney. The furnace is the gut. And here is the part that costs American pet parents real money. The American Veterinary Dental College reports that most dogs show some sign of periodontal disease by age 3, so the standard answer to bad breath is a professional dental cleaning under anesthesia, which in most U.S. cities runs somewhere between $600 and $1,400. That cleaning is often genuinely necessary, but I see dogs every single month whose owners paid for that cleaning, got 5 or 6 good weeks, and then watched the exact same smell come back because nobody looked below the collarbones. So before you spend anything, let go of the guilt right now. You have not failed your dog. You brushed when you could, you bought the chews, you tried the water additive, and the smell came back anyway, because you were treating the wrong end of the pipe. What if I told you that for a large group of these dogs, the thing that finally moves the needle is a spice that is probably sitting in your kitchen cabinet right now, costs about $4 at any grocery store, and has been used for digestive trouble in humans for well over 1,000 years? In this video, I am going to walk you through exactly how to use it, exactly how much to give based on your dog's weight in pounds, and exactly how to tell whether your dog's breath is a gut problem, a tooth problem, or one of the rare smells that means you need a real veterinarian the same day. And later on, I am going to tell you about a Yorkie named Daisy, whose teeth were the cleanest I had seen all year, whose breath could clear a room, and whose real problem was something almost no one checks. Keep that name in your head, because Daisy is the case that changes how you think about this. Here is exactly what you are getting in this video, so grab a notebook, because this is a masterclass, not a highlight reel. Promise number 1 is the one spice protocol itself, fennel seed, with the exact dose per 20 pounds of body weight, how to prepare it 2 different ways, and the 3 situations where you should skip it entirely. Promise number 2 is the 60-second flip the lip check you can do on your couch tonight that tells you whether the smell is actually coming from the teeth before you spend a dime. Promise number 3 is the water bowl mistake happening in most American homes right now that quietly reseeds odor bacteria every single day, and the 2-minute fix. Promise number 4 is the food label audit, the one thing to look for in the first 5 ingredients on your kibble bag that feeds the stink from the inside. And promise number 5 is the breath smell that has nothing to do with teeth or gut at all, the one that means an emergency vet visit within 24 hours, which I will spell out for you near the end. Because reassurance only counts if I am also honest with you about danger. I am a small animal veterinarian, and here on the Pantry Vet, my whole job is teaching pet parents what the exam room does not have time to teach. My clinic week runs about 30 dogs, and chronic bad breath is the single thing owners apologize to me for most often. Nobody should be apologizing. Today you get the full picture. Let me tell you about Cooper, because Cooper is the dog I think about every time this topic comes up. Cooper is a 7-year-old chocolate Labrador, 78 pounds, and he lives outside Columbus, Ohio with his owner Maria, who is 61 and retired from teaching middle school. Maria is exactly the kind of pet parent I love, the kind who notices things, and what she noticed, starting about 2 years ago, was that Cooper's breath had gone from normal dog breath to something she described as low tide at a fish market. She did everything right. She took him in. Cooper got a full professional dental cleaning under anesthesia in January, and in central Ohio that visit came to $1,140 with the blood work and the extractions of 2 loose premolars. And it worked. For 5 weeks, Cooper's breath was fine. Maria told me she cried a little the first morning he yawned in her face, and it smelled like nothing. Then, in week 6, the smell came back. Not slowly. Within about 10 days, it was right back where it started. So Maria did what millions of American pet parents do. She went to the pet store and started buying. A water additive for $19, dental chews at roughly $32 a month, a breath spray, a finger toothbrush kit. By the end of that year she had spent, by her own math, over $1,400 beyond the cleaning, and Cooper's breath was unchanged. Her regular clinic, reasonably, suggested a second cleaning. That is when she ended up in my exam room, mostly out of frustration. And here is what I found in the first 10 minutes, not by looking in Cooper's mouth, but by asking about everything else. Cooper had gas that could empty the living room. Cooper ate grass almost every morning. Cooper's stomach made loud gurgling sounds in the evening, what Maria called the washing machine, and Cooper's breath was dramatically worse first thing in the morning, before breakfast, than it was at any other point in the day. Every one of those details points the same direction, and it is not up at the teeth, it is down at the digestive tract. Cooper's mouth was not the factory making that smell. His mouth was the chimney it came out of. And I am telling you Cooper's story not because Cooper is unusual, but because Cooper is completely typical of the dog whose breath comes back after an expensive cleaning, and the pattern Maria almost missed is the same pattern that thousands of pet parents watching this video are living with right now. So let me explain the mechanism. In plain language, you could repeat to a friend over coffee. Bad breath in a dog comes from one of 2 directions. Direction 1 is the mouth itself. Bacteria live in plaque along the gum line. They break down protein, and they release sulfur compounds, the same family of chemicals that make rotten eggs smell like rotten eggs. When the smell truly comes from the mouth, a professional cleaning fixes it, and it stays fixed as long as you maintain the teeth. That is real, it is common, and I never want you to skip dental care. But direction 2 is the one almost nobody talks about, the digestive tract. When the balance of bacteria in your dog's gut tips the wrong way, a state veterinarians call dysbiosis, food starts fermenting instead of digesting cleanly. Fermenting protein produces gases with genuinely ugly names: hydrogen sulfide, cadaverine, putrescine, and those gases do not just exit out the back of the dog. They come up. They come up as burps you never hear, as reflux, as that little lip-licking gulp dogs do when stomach acid rises at night. The mouth and the stomach are one connected tube, and smell travels through a tube in both directions. This is why Cooper's cleaning bought him exactly 5 weeks. The cleaning scrubbed the chimney. The furnace downstairs kept burning. Now, here is the detail that almost no article on dog breath will tell you, and it is the single most useful diagnostic clue you can gather for free. Pay attention to when the breath is worst. If the breath is roughly the same all day, think mouth. If the breath is dramatically worse first thing in the morning, on an empty stomach, and improves after your dog eats breakfast, think gut. And specifically think overnight acid and bile reflux, because an empty canine stomach sitting for 12 hours is a reflux machine. Cooper hit every marker. Morning breath from the basement, gas, grass eating, gurgling, lip licking at night. So where does the spice come in? The spice is fennel seed. Plain whole fennel seed, the pale green striped seeds sitting in the spice aisle of every Kroger and Safeway in America for about $4 a jar. Fennel is what herbalists call a carminative, which is a fancy word for a plant that helps the digestive tract move gas along instead of letting it sit and build. Its main aromatic compound, anethol, has shown mild antimicrobial and antispasmodic effects in laboratory and small human studies. And fennel has more than 1,000 years of traditional use for exactly this problem, in humans and in livestock. I want to be careful and honest with you here, the way I promised. The research in dogs specifically is thin. What I can tell you is what I see in practice, which is that for dogs whose breath traces back to gas, fermentation, and reflux, fennel is one of the safest, cheapest first moves available. And for many of these dogs, the change in breath and gas shows up within about 2 weeks. It is not a drug, it is not a cure for dental disease, and it is not a substitute for your veterinarian. It is a low-cost, low-risk lever, and when Maria added it to Cooper's routine, along with 2 other changes I am going to teach you today, his morning breath was, in her words, boring by day 11. Boring is the goal. Now let me show you 3 more dogs, because your dog may not look like Cooper, and I want you to find yourself somewhere in this list. First, Bella. Bella is a 3-year-old French bulldog in Phoenix, Arizona, owned by a 29-year-old nurse named Danielle who works nights. Bella's breath had a sour, almost fishy edge, and her gas was legendary in that apartment. Here is what matters about Bella. She is brachycephalic, a flat-faced breed, and flat-faced dogs swallow enormous amounts of air when they eat and drink, especially when they inhale a bowl of kibble in 90 seconds flat. All that swallowed air churns through the digestive tract, carries fermentation gases with it, and comes back up in burps all day long. Danielle had been quoted for a dental cleaning, but Bella's teeth, at 3 years old, were honestly fine. What fixed Bella was not a cleaning. It was a slow feeder bowl for about $12, meals split from 1 to 2 per day, and a fennel seed tea poured over her food. Within 3 weeks, Danielle texted the clinic that both ends of the dog had calmed down. If you own a Frenchie, a pug, a Boston Terrier, or a bulldog, Bella is probably your dog. Second, Duke. Duke is a 10-year-old German Shepherd near Duluth, Minnesota, 89 pounds, owned by a retired electrician named Frank. Duke's pattern was pure nighttime. Around 4 in the morning, Frank would hear him licking his lips, gulping, sometimes eating carpet fibers, and about once a week, Duke would vomit a small puddle of yellow bile foam on an empty stomach. His morning breath was sour and sharp. That is classic empty stomach bile reflux in an older large breed dog. Duke's fix was scheduling, not scrubbing. Frank moved dinner later, added a small bedtime snack of about a 1/4 cup of kibble so the stomach was never empty for 12 hours straight, and added ground fennel to the evening meal. The 4 in the morning licking stopped inside of 2 weeks, and the morning breath followed it out the door. If your dog is a senior and the breath is worst at dawn, Duke is your dog. Third, and this is the one I promised you at the start, Daisy. Daisy is a 5-year-old Yorkie in Charleston, South Carolina, 6 pounds of attitude, owned by a couple who took dental care more seriously than almost any clients I have ever had. Weekly brushing at home, groomer visits, a professional cleaning 18 months earlier. When I flipped Daisy's lip, her teeth were genuinely beautiful. Pale pink gums, no tartar, nothing. And her breath was terrible. Rotten, constant, all day. Daisy is the case that proves the point of this entire video, because with a mouth that clean, the mouth could not be the source. We ran through her history and found the clue in her food bag. Daisy had been eating the same chicken-based kibble her whole life, and she also had chronically soft stool, occasional ear gunk, and paw licking, the quiet signature of a dog who is not tolerating an ingredient well. Poorly digested protein is exactly the fuel that gut bacteria ferment into those sulfur gases. Her owners ran a strict 2-week single protein trial on a fish-based diet, added the fennel protocol, and by the recheck a month later, the breath was simply gone. No cleaning, no procedure. A food change and a $4 spice. If your dog's teeth look clean but the breath says otherwise, Daisy is your dog, and the answer is in the bowl, not the mouth. All right, notebooks out, because here is exactly what to do, in order, starting tonight. Step 1. Before anything else, do the 60-second flip the lip check, because I need you to rule the mouth in or out first. Sit with your dog somewhere calm, lift the upper lip on one side, and look at 3 things. 1. The color at the gum line, right where gum meets tooth. Healthy is pale pink. A thin, angry red line along that border means gingivitis. 2. The teeth themselves, especially the big upper molars in the back, which is where tartar builds first. A little yellow film is normal life. Thick brown or gray crust like a barnacle is dental disease. 3. Gently press a finger on the gum and see if your dog flinches or pulls away. Then repeat on the other side. If you see red gum lines, heavy brown crust, wobbly teeth, or pain, stop right here, because your dog likely needs a real veterinary dental exam, and no spice on earth fixes an infected tooth. That is not a failure, that is a diagnosis, and it is the honest edge of what home care can do. But if the mouth looks reasonably clean and the breath is still bad, congratulations, you just saved yourself from paying to scrub a chimney, and you move to step 2. Step 2. The fennel protocol itself. Buy whole fennel seed from the spice aisle, plain, with no additives, and I want to be very clear, seed only, never fennel essential oil, which is far too concentrated and is not safe to dose at home. You have 2 ways to serve it. Option 1 is the tea, which is my favorite for picky dogs. Take 1 teaspoon of whole fennel seeds, steep them in 1 cup of hot water for 10 minutes, strain, and let it cool completely to room temperature. Pour a portion of that tea over your dog's food, about 2 tablespoons per 20 pounds of body weight, once a day. The rest keeps covered in the refrigerator for up to 3 days. Option 2 is the powder. Grind the seeds fresh in a cheap coffee grinder and sprinkle it directly on food, about 1/8 of a teaspoon per 20 pounds of body weight once daily, and I would cap even a giant breed at half a teaspoon a day. Start at half that dose for the first 3 days to check tolerance, then move to the full amount, and give it a fair trial of 2 to 3 weeks before you judge it. Now the 3 skip situations I promised. Skip fennel if your dog is pregnant. Skip it and ask your vet first if your dog takes any daily prescription medication, especially for seizures or hormones. And stop it if you ever see vomiting, diarrhea, or itching after starting, which is uncommon but possible with any new food. When in doubt, 1 phone call to your own veterinarian settles it, and a good vet will never be annoyed by that call. Step 3. The water bowl. And this one stings a little because it is hiding in plain sight. Your dog's water bowl grows a slimy film called biofilm, a living mat of bacteria, and a 2011 NSF International Household Germ Study found pet bowls ranked among the germiest spots in the entire American home. Every drink your dog takes rinses that bacteria across the mouth. So, wash the bowl with hot water and dish soap every single day. Not a rinse, an actual wash. Run it through the dishwasher once a week, and if you are using a plastic bowl, replace it with stainless steel, because plastic scratches, and those scratches are bacteria apartments. This costs about $10 at PetSmart or on Chewy and takes 2 minutes a day. Step 4. The food label audit. Go get your kibble bag right now and read the first 5 ingredients, because those 5 are most of what your dog actually eats. You are looking for 2 things. First, vague unnamed proteins, phrases like meat meal or animal byproduct without naming the animal, which make it impossible to know what your dog is digesting or reacting to. Second, whether one single protein, very often chicken in American kibbles, has been the only protein your dog has eaten for years, while your dog also shows soft stool, gas, paw licking, or itchy ears. If that pattern sounds like your house, talk to your vet about a proper 2-week single protein trial on a novel protein like fish or lamb, and be strict about it. No other treats during the trial, because 1 biscuit a day quietly ruins the whole experiment. Step 5. Add a daily crunch habit for the teeth themselves, because we still want to protect the chimney. The cheapest option in America is a raw carrot, cut into chunks sized safely for your dog, a few pieces a day as the treat ration. If you prefer a commercial dental chew, flip the package and look for the VOHC seal, the Veterinary Oral Health Council mark, because that seal means the product actually had to show plaque or tartar reduction in trials, rather than just claiming it on the front of the bag. 5 steps. The lip check tonight, fennel starting tomorrow, the bowl washed daily, the label read this week, the crunch habit ongoing. That is the whole protocol, and the total new spending is under $20. Now, one bonus move before the serious part, and this is the single most shareable thing in this video. I call it the breath decoder, and almost no pet parent has ever been taught it. Different failing systems produce different smells, and your nose can sort them. Smell number 1, rotten, sulfurous, like eggs or garbage. That is the one this whole video covered, teeth or gut, and you now have the full playbook. Smell number 2, sweet and chemical, like nail polish remover or overripe fruit. That can be acetone on the breath, and in a dog who is also drinking buckets of water and urinating constantly, it may point toward diabetes. Smell number 3, sharp like ammonia, like a urine smell coming from the mouth. That can happen when the kidneys are struggling to filter waste, especially in older dogs who are also eating less and losing weight. Here is the caveat that keeps this honest. Your nose is not a diagnosis, and plenty of dogs with weird breath have neither condition. But the smell tells you which conversation to have and which simple blood test to ask your veterinarian about. That one piece of vocabulary, walking in and saying the breath smells like acetone, can shortcut weeks of guessing. Which brings me to the part of every video I will never skip, because you have trusted me for 20 minutes and I owe you the truth about danger. There are breath situations where home remedies are the wrong answer and the clock matters. Go to a veterinarian within 24 hours if you smell that sweet acetone breath alongside heavy drinking and urination, because untreated diabetes can tip into a crisis fast. Go within 24 hours for ammonia breath combined with vomiting, weight loss, or a dog who has stopped eating. Go the same day, today, if bad breath arrives suddenly along with drooling, blood-tinged saliva, pawing at the mouth, swelling on one side of the face, or a dog who cannot close the mouth comfortably, because that pattern can mean an abscessed tooth, a stick or bone fragment wedged across the palate, or a growth that needs eyes on it now. And if the breath ever smells strangely chemical, and you have any reason to suspect your dog got into antifreeze, sugar-free gum containing xylitol, or any household chemical, call the ASPCA Animal Poison Control Line right now at 888-426-4646. 4435 and head to the nearest emergency vet while you dial. Everything else in this video is education, not a substitute for hands-on veterinary care, and the fennel protocol is a support for a healthy dog with a smelly gut, never a replacement for diagnosis when these red flags are present. The reason you can trust the gentle advice on this channel is that I will always tell you plainly where the gentle advice ends. So if you take nothing else from these 25 minutes, take this. Tonight, flip the lip and look for 60 seconds. Tomorrow morning, notice whether the breath is worse before breakfast than after, because that single observation splits mouth from gut better than any product on the shelf. And if the trail points to the gut, 1 teaspoon of fennel seed steeped in a cup of water, poured over the food bowl once a day, plus a clean bowl and an honest look at the label, may do for your dog what an $1,100 repeat cleaning could not do for Cooper. Maria measures success in yawns now. Cooper yawns in her face every morning, and it smells like nothing at all, and that is the whole point. Your dog cannot tell you the furnace is smoking, so the breath tells you instead. And now you speak the language. If this video helped you, the like button genuinely helps this reach the next worried pet parent, and subscribing means you will not miss the next one, where I am covering the 3-ingredient soak for dogs who will not stop licking their itchy paws, including the one common kitchen ingredient you should never use on broken skin. And if you know one person whose dog's kisses make them turn their head, a friend, a parent, the neighbor with the sweet old lab, send them this video today, because they are probably 2 weeks and $4 away from fixing it. Your kitchen is your first clinic, and I will see you there.